The mayor is passionate about preventing drug overdoses. One proven way to do this is by creating supervised drug consumption sites. The mayor cites one in New York City as he would like to use as a model in Baltimore. On Point NYC, operators say it's a place where lives are saved, a judgment-free zone where lives are changed. Participants bring in their own drugs, sign in, write down what they're using. The goal is to keep people alive until they're ready to seek treatment. Overdose prevention is another legislative priority. Why does the city need enabling legislation to establish supervised consumption sites? And the Baltimore Police Department is now a city agency. Can't you instruct hands-off approach to establish sites?
Well, it's not just about that. It's about what's prohibited at state law.
On Point NYC, a nonprofit, operates 2 facilities that provides a safe place to use illegal drugs. They are funded through the New York Health Department, federal grants and donations. Everyone who works in the drug ingested area has a medical background. They test for a variety of substances, often mixed with illicit drugs, that can trigger an overdose. Medical personnel stand behind mirrors to check on users every 3 minutes. If they see any sign of an overdose, they immediately respond.
I think the most important portion about this, David, is that wherever you see these sites, you don't see overdoses.
On Point NYC also has wraparound services that make it successful. The mayor has visited the New York site many times.
We have to be able to convince these folks when they're ready. But when you talk about overdose prevention sites, you're doing that opportunity where folks who have that addiction are going to use one way or another. You're allowing them to do that in a supervised way with public health professionals and others, and having the resources there when they are ready to get clean.
Mayor Scott tells us he knows it's a tough sell, but will fight for it because he feels it's right.
I think that we have shown a tendency to do what's right and not what's popular. It wasn't popular for us to do the violence reduction strategy the way that we did it, right? And I think that when you look back at history, if we looked at what Mayor Smoke said about drug use and violence 30 years ago, today we're like, oh, he's right.
Try to treat it as a public health problem, and you'll have a positive impact on public health and a positive impact on your crime situation.
The mayor says the new Speaker of the House supports these sites. Similar legislation has failed in the past, but the mayor says if a bill is introduced in this upcoming session, he will push for passage. Reporting from City Hall, David Collins, WBAL TV 11 News.